They're joining me now, Dr. Celine Gounder, infectious disease specialist, epidemiologist, and editor-at-large for public health at KFF Health News, and MS Now's Josh Einiger here with me. And Josh, let's just start with the protocol once the ship docks. What are these passengers going to face? Is there a quarantine?
Well, Ariel, you can imagine after what the world went through with COVID, the people in the Canary Islands do not want this boat anywhere near them, even if epidemiologists say there's not much of a risk for them. So what's happening is they're actually going to anchor it off the port, and they're going to bring medical personnel onto the ship. There's 149 passengers and crew that hail from 23 countries, and the plan is only 14 of them are actually Spanish nationals. They will go to a military hospital. The rest of them won't even really set foot in Spain. The U.S. government has sent a plane for the 17 Americans who are on board that ship. And even if people are symptomatic but don't need urgent medical attention, they are out of Spain and back to their home country.
It's going to be quite an undertaking, especially given how many foreign nationals there are on board that vessel, and can't imagine the harrowing ordeal that those passengers are experiencing. Dr. Gounder, this has really freaked out a lot of people, of course, on that boat, but not on that boat as well. For some people, the first time they even heard of hantavirus was when Gene Hackman's wife died of it. How contagious is this virus, and how concerned should all of us be?
We've just gotten some really good news over the past day. So there was a Dutch flight attendant who worked the KLM flight carrying one of the hantavirus infected passengers who was later hospitalized with symptoms. That flight attendant, her PCR and antibody test came back negative for the Andes virus. So her symptoms must have been caused by something else. Had she tested positive after a brief contact on a commercial flight, that may have indicated that the virus spread more easily than we had thought. There's also now a Spanish woman who was sitting 2 rows or so behind a hantavirus infected person on a commercial flight. That person is also being tested. If that person also comes back negative, that would be further reassurance that it is difficult to transmit just through casual contact. What we have seen with the Andes virus, so that's the form of hantavirus we're dealing with in this situation, you do see person-to-person spread, but it's only through very close contact. So sexual partners, for example, people who are sharing a bed. While it is not a sexually transmitted disease, it's that level of closeness that we've seen in a prior outbreak involving hantavirus. 18% of sexual partners got infected by a person with hantavirus. Excuse me. Other household contacts, about 1%. So for the general public, the risk here is exceedingly low.
So, Doctor, I recognize that the understanding is the risk is low, but people are still worried because you talk about close quarters, close contact. And of course, when you're traveling, that's exactly what you are experiencing, maybe not to the degree that you were referencing. So should people be worried as they travel?
No, because we now have a handle on the passengers who are on the cruise ship. You had a few who disembarked early on, but they have returned home. And it's really the passengers who are now in the process of returning home that is being handled by the authorities. Most of those passengers, we believe, are going to be going on chartered flights. There may be some that do go on commercial flights, and I think that does need to be watched and monitored closely. However, we have yet to see casual contact leading to transmission.
Yeah, Doctor, you probably are struggling with allergies, as Josh and I both are here at the desk as well. Josh, I understand that some of these passengers were allowed to disembark before they were tested for any symptoms.
Right.
So how concerned, are people out there?
Well, I mean, this gets to sort of, here we are 6 years after COVID, and there was no contact tracing. There weren't the usual things that you would expect, or at least we all learned about during COVID. We're talking about there's a flight attendant there was concern because she had contact with somebody who had gotten off the boat. At a previous port of call, after this started, but before they had confirmed it was hantavirus, they let a little more than 24 people off the ship, and then they just proceeded on their merry way to wherever they were going. At least 8 of them are Americans, and they are now home in 5 different states being monitored by their respective state health departments. But I think it speaks to there is still such confusion in these matters, and people were just allowed to get off the ship, and then obviously they discovered what it was.
Doctor, if you can, talk to me about the incubation period, because it's quite long. And so I think what is alarming to a lot of people who are learning this is that it may take a while for those symptoms to present, if at all, and to track down these people who may be well away from where they originated.
Well, the good news is that actually gives you more time. It gives you more time to track down those people, to institute infection control practices, to help them quarantine safely. So that's actually a good thing in this particular situation. It's not pleasant for the people who need to be quarantined after an exposure. It means that they have to wait that much longer before returning to their regular activities. But it means for public health authorities, they have more time.
All right. Dr. Celine Gounder, thank you so much for your insights. Josh Einiger, thanks for staying on top of this. Appreciate both of you.